Good afternoon and welcome to today's session, Law as a Tool to Advance Public Health. This webinar is sponsored by the Network for Public Health Law and will feature speakers offering highlights of 2 workshops that will be convened as pre-conference sessions on the day before the start of the 2018 National Public Health Law Conference. I'm Charles Trong, the Digital Marketing Coordinator at the Network for Public Health Law's National Office, and I will be your host for today's webinar. Today's session will be recorded and posted on the Network for Public Health Law's webpage. Please feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the Ask drop-down menu, and submit your question. If you do not see the Q&A tab available, click on the button with the 3 dots highlighted in the picture. Your moderator for today's webinar is Alexis Etow. Alexis is a senior staff attorney at ChangeLab Solutions, where she leads the organization's work at the intersection of education and health. This work focuses on developing legal and policy strategies that advance safe and supportive learning environments, resiliency, and health equity. Previously, Alexis worked for local, state, and federal agencies and have covered a range of areas, including tobacco control and youth-targeted marketing, food policy, affordable housing, and environmental justice. Alexis will be leading us through the rest of today's webinar, so Alexis, over to you.
Great, thanks Charles, and hello everyone. I'm excited to serve as your moderator for today's webinar. As mentioned, this webinar will preview 2 important pre-conference workshops at the 2018 Public Health Law Conference in Phoenix, Arizona, this October 4th through 6th. If you haven't already done so, please register for the conference and the pre-conference sessions of interest to you. Law and policy impact almost every public health challenge and are essential tools for protecting and promoting the health of the public. So no matter what role you play in the public health system, there will be something on the agenda for everyone. The workshops that are the focus of today's discussion are designed to empower public health professionals in understanding and analyzing the connection between law and health outcomes. Today's presenters will discuss the tools and resources their workshops will provide to assist in building the capacity of the field to understand and use law as a public health tool. We're fortunate enough to have 2 excellent speakers with us today. After briefly introducing them, I'll turn the mic over and we'll get started on the substance of our program. We'll also save some time at the end for Q&A. And as Charles mentioned, please keep in mind that you can enter questions at any time throughout the course of the discussion in the chat box on the lower right side of your screen. So let me go ahead and introduce our speakers. Our first speaker is Montrece McNeill Ransom. She currently serves as a Senior Public Health Analyst and Team Lead for Public Health Law Training and Workforce Development with the Public Health Law Program in the Office for State, Tribal, Local, and Territorial Support at the Centers for Disease Control and Prevention. Currently, her primary focus is developing and delivering trainings aimed at increasing the capacity of public health practitioners across governmental levels to understand and use law to advance public health goals. She has presented trainings, taught courses, and published on a broad range of topics, including public health emergency law, tribal public health, health disparities, careers in public health, and environmental public health law. Our second speaker is Lindsay Cloud, the Director of the Policy Surveillance Program at the Center for Public Health Law Research, also known as CPHLR, at Temple University Beasley School of Law. Her work focuses on the intersection of law and public health. She oversees the creation of large-scale public health law research projects using legal epidemiology to scientifically analyze and track state, local, and international policies across various public health law domains. In addition to managing the creation of CPHLR projects, Lindsay trains government agencies, policymakers, researchers, and other external organizations on the tools and transdisciplinary methods used in public health law research with an aim towards applying law as an intervention to influence better health, well-being, and equity. So with that, I will hand it off to Montrece to take it away.
Thank you so much, Alexis, for that introduction. Super excited to be here to offer a teaser of a workshop that we are going to be offering at the 2018 Public Health Law Conference really a Train the Trainer workshop focused on tools that we're offering in the Public Health Law Academy. So I need to start with a disclaimer. Every presentation we offer, we start with a disclaimer. It just notes that the contents of this presentation have not been formally disseminated by CDC, and they shouldn't be construed to represent any agency determination or policy, because Lindsay and I both will be talking about law and legal tools. It's also important to note that these presentation materials are for instructional and informational use only, and we're not intending to provide any professional, legal, or other advice on this line. Always seek the advice of an attorney or other qualified professional if you have any questions regarding any legal matters. Okay, so the Public Health Law Academy is an online, on-demand training system that was developed as a core project under a cooperative agreement between CDC and ChangeLab Solutions. The major purpose of the cooperative agreement, or COAG as we call them, is really to build the capacity of state, local, tribal, and territorial health departments and their practitioners to effectively use evidence-based legal and policy strategies to improve health outcomes in their communities and throughout the nation. The Public Health Law Academy project really reaches deeply into the major purpose of the entire cooperative agreement, which is namely to provide educational resources and training to the public health workforce to build its capacity to use the tools of law and policy to improve health outcomes. As was mentioned in my bio, I work with the Public Health Law Program that sits in the Center for State, Tribal, Local, and Territorial Support proposed at CDC, and the Public Health Law Program is the primary unit responsible for working with ChangeLab Solutions on the development of the Public Health Law Academy. The mission of our program is really simple. It's to advance the understanding and use of law as a public health tool, and we work in a wide variety of areas and on a wide variety of projects toward that goal. We provide training and technical assistance to jurisdictions across the country on how to use law to improve public health outcomes. Our partner, ChangeLab Solutions, is an Oakland-based nonprofit that aims to create innovative laws and policies to ensure everyday health for all, whether it's providing access to affordable healthy food and beverages, creating safe opportunities for physical activity, or ensuring the freedom to enjoy smoke-free air and clean water. These solutions address all aspects of just vital and thriving community. And these are the areas in which ChangeLab Solutions work. So we're honored to partner with them as we continue to build the Public Health Law Academy. So why public health law? Well, from our perspective, and I don't want to speak for Alexis or Lindsay, but from where we sit in the public health law sandbox, there is no public health without the law. From the creation of a health department, which is done by statute, or the passing of an ordinance that mandates the reporting of prescribing practices, it really is the law that creates the framework that helps make healthy choices the norm. And as many of you know, there's hardly a public health challenge today that can be resolved without some contribution of a legal or policy solution. For example, state and local laws and policies can save lives by increasing access to naloxone, the opioid overdose medication often used to reverse the effects of narcotic drugs. We see law being used to influence when and how public health practitioners require and enforce mandatory vaccinations, and when and how health officials invoke isolation and quarantine orders or take other control measures to protect the public's health. We see law being used to prohibit smoking in multi-unit housing, to protect the health of other residents in the development from harmful and offensive secondhand smoke, and the use of law to create access to healthy housing generally. Law is also critical to implementing the 10 essential public health services. Services number 5 and 6 specifically mention developing policies and enforcing laws. Service number 8 calls for a competent workforce, and this definitely should include competence in law and legal frameworks for public health practice. And Service 9 focuses on evaluation, And more practitioners are recognizing the importance of evaluating the effectiveness of our laws and policies and their overall impact on public health. For our partners in the field that are focused on accreditation, Standard 6.2 specifically calls for health departments to educate individuals and organizations on the meaning, the purpose, and the benefit of public health laws and how to comply. And this quote here from Michael Bloomberg that I love to offer in my presentations really kind of sums it up. In the realm of public health, it's the law that really does the work. It's been demonstrated time and time again in areas ranging from mandating vaccinations to requiring automobile seatbelts, improving workplace safety, the inspections of meat products, and the fluoridation of water. Public health succeeds by making healthy choices the norm. So we know this, and this has been studied and it's been written about by scholars about the importance of integrating legal studies in public health education. And while we know that today's public health professionals, especially those that work across stilts, across the state, tribal, local, and territorial levels, while we know they need to have a clear understanding of our legal system and the role that it's played and continues to play in improving overall population health, we know that also that most public health practitioners and health professionals in the field do not receive formal public health law training. So to address this, the Public Health Law Program and ChangeLab Solutions have spent the last 4 years developing the Public Health Law Academy. Again, our overall strategy is really to infuse and integrate the public health workforce with improved competencies and the confidence and information that's needed to use legal and policy tools in evidence-based strategies to improve population health outcomes. So the suite of services that are provided under our Public Health Law Academy project has been specifically designed to provide powerful new resources to both public health agencies and their non-governmental and community-based partners, with an aim toward increasing working relationships between public health practitioners and their attorneys. The training resources that are currently available online and on demand can be found at publichealthlawacademy.org. Our team is using the CDC-branded version of Public Health Foundation's Train platform as a primary vehicle for reaching the target audience, which, as I mentioned, include public health practitioners and health system partners across all subject matter areas and levels of government. So I want to quickly touch on some of the trainings that we offer in the Academy. Currently, there are 9 trainings in 3 clusters. The Introduction to Public Health Law cluster, our Hot Topics cluster, and our series of trainings on legal epidemiology. So our Introduction to Public Health Law trainings really explore the critical role that law plays in everyday public health practice. It covers core public health law concepts that we believe public health practitioners across the board really need to be familiar with. For example, what is the history of public health law? How do practitioners balance the common good against the rights of affected individuals? What does the Constitution require? What is preemption? And how does it impact public health? To answer these questions, we have courses that are listed here on this slide: our Public Health Law Past and Present, Preemption in Public Health, Structure of Government, and exploring the fabric and framework of public health powers. And these series of trainings really are aimed at exploring the transdisciplinary nature of public health practice. We provide some practice tips for how to use this information and provide everyday public health practitioners with tools and resources that they need. We also have provided some information on legal epidemiology, which is a relatively new field of study, and Lindsay's going to offer a little more insight into that in her workshop in just a few minutes. But legal epi is defined as the scientific study and deployment of law as a factor in the cause, distribution, and prevention of disease and injury in a population. Our legal epi trainings in the Public Health Law Academy are for both public health practitioners and lawyers that are interested in studying the connection between law and public health. Right now in our academy, we've got 3 trainings, and what you see on this slide here is an example of the way these legal epi trainings can be used. So let's say you learn about a variation in life expectancy along a highway in California. What you see on this slide is that there's a 12-year drop in life expectancy in 2 neighboring counties within miles of each other: 87 years old at exit 189 and 75 years old at exit 132. A lot of public health practitioners are starting to ask the question why, as my boss, Matthew Penn, likes to say, this ain't flu, folks. These are issues that we need to study, and these are prime questions for legal epidemiology to help answer. Legal epi works to investigate how differences in the existence or enforcement of certain laws can impact health. So in the slide that was previous, Merced County may include regulations about smoking or road safety or clean water. Or maybe Merced County and Fresno County have the same ordinances, but they differ in how they enforce the law. The Public Health Law Academy Legal Epi trainings provide public health practitioners with the basic skills they need to begin to think about how to do these kinds of assessments themselves. And then we've also got our segment or our series of topics that we are calling hot topics in public health law, because we know the field of public health is constantly evolving in response to emerging emergencies, natural disasters, healthcare shortages, as well as emerging public health issues, including things like the opioid epidemic. When these kinds of things occur, understanding the law is critical to effective public health response. And it's not just response of our public health practitioners. So what can first responders and practitioners across the health system legally do in the event of an outbreak? How can we better use the services of healthcare partners across the spectrum to increase access to and quality of care? What sort of legal options do we have that are available to reduce prescription drug overdose? To help practitioners and our partners across the system help answer these questions, we've developed the trainings that you see listed on the slide there. So in addition to having the online trainings available, we've created what we've called Academy Facilitator Toolkits. And these toolkits accompany each of the trainings, and they're meant to provide opportunities for public health practitioners, trainers, folks that are responsible for talent management, to take what we've created for the Academy, the online, on-demand trainings that individuals can take, and customize them to meet the needs of your jurisdiction. So each toolkit, which you'll soon be able to access on publichealthlawacademy.org, will feature a facilitator's guide and a set of downloadable PowerPoint slides that have been customized or available to be customized for your jurisdiction's needs. The facilitator's guides includes the information for facilitators on how to proceed with developing, creating, and implementing a training, as well as a checklist of things that may be needed in order to get a training off the ground. And so our goal in our session at the Public Health Law Conference in October is to go through what's included in the Facilitator Toolkit, to really do a Train the Trainer session. So if you join us on October the 3rd at our session, you'll have an opportunity to not only view some of the trainings, but we hope that you'll learn how to use the materials in the toolkit to create and customize trainings yourself. Again, our session is on October 3rd, 2:30 to 4:30 p.m. Our faculty will include Maris Ash, who is the founder and CEO of ChangeLab Solutions, who's going to talk to you about the background, why we created the Academy, some of the efforts that we undertook and folks we work with to create the trainings. Abigail Farrell, who is the team lead for partnerships and communications with the Public Health Law Program, is going to do our icebreakers and our introductions and really get people thinking about the role of law and how we all play a role in ensuring the competence of our public health workforce. Matthew Penn, the director of the Public Health Law Program, is going to talk about how you can make these materials your own. As trainers in the field, as folks that may be non-lawyers, how can you take this legal material and make it your own and customize it to fit the needs of your jurisdiction? And then I'll be there to MC the program and to kick things off and to lead what we're calling a listening session toward the end of our workshop. So again, those are our goals: to explore the role of law as a foundation for public health practice, to teach you guys and relay some methods to teach legal principles using the Public Health Law Academy tools, and to hopefully empower a group of people to help fill a critical competency gap in our public health workforce. And with that, I will pass the mic to Lindsay and give her a chance to talk a little bit about her pre-conference workshop, and then I'll come back on the line for any questions at the end.
Great, thank you, Montrece. That was wonderful. So Montrece really gave a great overview as to why law plays such an important role in public health. And I know we're all really excited to head to Phoenix in just a few weeks. So I'll be giving you a preview of what you should expect at our pre-conference session. So the basics. Our workshop will be a hands-on crash course in legal mapping, techniques, and tools. It will be on October 3rd, the same day as Montrece's, from 3 to 5 p.m., and it will be presented by our Center Director, Scott Barris, along with myself. So by the end of the workshop, you will be able to distinguish between the different types of legal mapping techniques. You'll be able to learn the steps of the policy surveillance process, which is a form of legal epidemiology. You'll understand the ways policy surveillance may be used in research and practice. And finally, you'll identify tools and resources that you can use to create and access legal mapping data. And we will be handing out some of the tools and resources while we are there. So let's give you a short teaser on what you'll actually learn. So we'll be discussing in detail the different types of legal mapping models, which you see on the screen. Legal mapping is simply a process to assess and capture important features and variation in public health laws and policies across space and over time. Now, there are two main forms of legal mapping. One is legal epidemiology and one is public health law practice. So legal epi uses a more rigorous scientific approach. It needs more resources to deliver a product with a strong emphasis on quality control. Whereas public health law practice uses more traditional legal research skills to answer questions quickly with more limited resources. We'll get into further detail at the actual workshop about each legal mapping model that you see in orange on your screen, the type of data each of these mapping models produces, the time period and geographic parameters that each will produce, along with the resources that are necessary to carry out these mapping models. So who uses legal mapping? These are just a few of the different types of groups that use legal mapping in practice, and by use we mean in any form. Some of these people are producers of legal mapping models and some are users, so such as researchers. They will use the data to perform evaluation. So one form of legal mapping that our center specializes in and will be the focal point of the workshop is policy surveillance, because policy surveillance is one method to practice legal epi, as I just said. The methods are borrowed from science to create data that can be used for research and evaluation. So what is policy surveillance? Simply, it analyzes laws across space and over time. And the law can exist at any level. So we look at state level law, national level law, local law, and also institutional policies like school district policies or hospital policies. Policy surveillance doesn't just capture whether or not there is a law in the jurisdiction, but also the key provisions of the law. This practice really grew out of the need for reliable legal data sets so we could evaluate the impact of the law on policy and health, just as Montrece mentioned in the vaccinations and the seatbelt examples. We wanted to evaluate whether the law was having a good effect, bad effect, or no effect at all, or an unintended effect. So you can't evaluate the impact of law on policy and health if you don't know where the laws are, what they say, and how they've changed over time. So how do we actually carry out policy surveillance? This is a snapshot of the process. I'll briefly review some of the steps next. But during the workshop, Scott and I will review each of these steps in detail using hands-on exercises, real-world examples to clarify both the why and the how of the process. So briefly, the first step of the policy surveillance process is scoping. This is simply where you identify the topic and parameters of your project. you ask your team some crucial questions like, what is the goal of your project? Who is our intended audience? Are the laws or policies that we're looking at easily accessible? Do I want to publish this project? So after you scope and you've identified a clear statement of purpose, you'll start to conduct background research by exploring the legal landscape of a chosen topic. You're not only doing this to familiarize yourself with the topic, you may want to do a policy surveillance project or a legal EPI project on a topic that you're maybe not as familiar with. So you're doing background research to not only familiarize yourself with the policy domain, but also to begin to develop a preliminary list of constructs. And constructs are simply important features of the law that can vary among jurisdictions. So if you're looking at, say, distracted driving, an important construct may be hands-free calling versus handheld calling, or texting versus calling. It's important to note that the process is very iterative, so you're returning to steps throughout the life of the process. So as you conduct your background research, you'll also refine your scope. So once you finish that, you'll begin to develop coding questions. And even with large, complex areas of law and policy, coding questions and the Q&A format of policy surveillance allows the law to be easily accessible for not only yourself, but for the end user, whoever's using your project. It's good for diverse audiences, including policymakers, researchers, the media, and the public. It's important that when you're writing questions, that you're measuring the law through strict observation rather than interpretation. Now, after this, of course, you have to collect the law that you want to study. So you gather the law by copying and pasting from state websites or local websites, and you organize it in a, organized fashion. So coding the law is simply using the legal text you collected to answer the questions that you've developed. The goal of coding is really to read, observe, and record the law rather than to read and interpret the law. We want to make sure that the data is objective so it can be used for evaluation. That is an important theme throughout the course of learning how to do legal EPI. So quality control really pervades throughout the whole project. We implement a certain percentage of independent research and coding throughout the life of the project. We also do a final quality control piece. We'll be discussing this in great detail during the pre-conference workshop, but now I just want to highlight that this is kind of our critical central piece of the entire project. Of course, once you finish all these steps, you'll be able to publish and disseminate your data set, whether it be on our center's website, which is lawatlas.org, or your own organization's website. And you also want to think about keeping a plan to keep your data set updated prospectively. So speaking of publication and dissemination, we should look at some of the things that policy surveillance produces. So it really fills the need for accessible, nonpartisan information about the status and trends in law and policy. It also creates reliable data for evaluation. Of course, it tracks changes to the law over time and measures progress. And it's a diffusion of innovative policy ideas, particularly through data visualization. So if you publish your data set with maps and tables, it's very easy to see the state of the law. Finally, it builds workforce capacity. So as I mentioned, the Q&A format of policy surveillance is great for non-legal audiences, especially the public health workforce, where there may be very few lawyers on staff. So to give you a peek of what policy surveillance may yield, here's an example of a published data set. And this data set analyzes youth sports traumatic brain injury laws from their inception in 2009 to July 1st, 2007. So with the mapping feature, you're able to see the law over time. This is a snapshot of July 1, 2017, where every state had a law. But if you were to go back in time, you would see that there was one law in 2009, there were 4 states that enacted laws in 2010, That jumped to 34 states in 2012. So once you visit lawatlas.org, you'll be able to see those changes over time. Each data set is also produced with some crucial documents that are published alongside with data set. One of those documents is the research protocol. The protocol outlines the entire methodology of the process. It includes quality control measures, the scope, data collection methods, important definitions, coding scheme rules. So the whole point of a research protocol is so that your project is replicable and transparent. Each project is also published alongside a code book, which identifies the variables and values that are included in your project. This is used in conjunction with the data page so that your data, your legal data, can be used for evaluation. Finally, we produce the data. So the data can be downloaded in Excel format and used, of course, in conjunction with the code book. So if you're interested in learning more, I hope you join us at the pre-conference workshop in Phoenix. And in the meantime, you can visit our website. As I mentioned, we have over 80 data sets that are freely available for download. We also have a learning library with tools to teach yourself the process itself, tools and resources and examples. I think that's it for me, so I will pass it back to Alexis for some Q&A.
Great. Thank you so much, both Montrece and Lindsay, for your presentation. I definitely learned a lot, and I know that I'm eager to learn more about your pre-conference sessions, and I'm sure our participants are too. So at this time, I want to invite participants on the line to ask any questions of our panelists related to their presentations. And I just highly encourage you to take advantage of this opportunity to ask some questions directly. And remember, you can use the chat box to ask your questions on the bottom right-hand corner of the screen. And it looks like there are a few in the queue already. So starting with, here's a question for Lindsay. Can you talk about the value of doing a legal epi study versus traditional legal research?
Sure. So one main value of doing legal epi is, of course, that it produces legal data that can be used for evaluation. The other piece of it that's more of a practical piece is that you don't have to recreate the wheel every time you do a project. The whole entire process of creating a policy surveillance project is about doing it once and keeping it updated versus traditional legal research where you end up doing a 50-state survey and kind of redoing your work every few years. We record all of our methods and our search terms in the protocol so that it can be easily updated. So in the long term, you end up saving time, even though, which we'll talk about at the pre-conference session, policy surveillance takes more time up front. It ends up saving you time in the long run.
Great, thanks. Here's a kind of a related question. What are some good strategies for whether you're part of an organization or an individual, if you want to do policy surveillance but don't have maybe the resources to conduct it?
So one, we work with a lot of organizations and their resources vary. One thing we always suggest is maybe partnering with us or partnering with other public health groups. We really try to avoid duplicating work. And we realize after talking to a bunch of different groups nationally, a lot of them are working on the same public health problem. So we suggest partnering with us or maybe even using legal interns or law students. We'll do that in-house when we're a little more resource-strapped. You can also just limit the scope of your project. We do a lot of 50-state projects, but there's no reason that if you're resource-strapped, you can look at, a handful of states, such as 3 to 5, and then expand upon that later on.
Great, thank you. And then a couple questions for Montrece. There's a lot of interest in the facilitators guides that you mentioned. Can you talk a little bit more about what's included in them, and also if you have any tips or maybe examples for tailoring the materials that are customizable?
Absolutely. So the Facilitator's Guides includes a facilitator script that kind of walks through language and text for each of the slides that's contained in the customizable slideshow. There also are some tips on adult learning principles and that sort of thing. With regard to customizing the slides, I think the most important thing is that we've left space and a clear call out for areas where jurisdictions should insert their own relevant laws, depending, of course, upon the topic. For example, when we talk about public health law past and present, there are some points to or references to Jacobson, for example, and we talk about the mandatory vaccination case, but there's space there for jurisdictions to add information on their own laws and their own case law that's happened in their area. There's also a few opportunities for interactive activities where we've placed some true and false questions, and the facilitators have room to add their own true and false questions as well as case studies. And so our goal is to offer something that can serve as the foundation that folks can build from, but it gives them at least something to react to and work from instead of having to start from scratch. That's the goal.
Great, thank you. And I have a question, actually kind of relates to both Lindsay and Montrece about being a non-lawyer and using either policy surveillance as a study or serving as a facilitator for the academy trainings. Do you have to be an attorney to do either?
Well, from where I sit, no, not at all. The nature of public health law is, as I've mentioned, it's transdisciplinary. We need a wide variety of folks at the table to really improve the use and understanding of law as a tool, and I'll let Lindsay speak to it, but when we think about legal epidemiology and legal mapping work, we know it's not just the domain for lawyers. The information and how we use the results that come from that work and that come from ensuring that our workforce is well trained on the role of law and its impact, that is not just for lawyers. It's definitely for anyone who sees the impact of law and policy on their work in public health.
So I would echo what Montrece said. This is definitely based in a transdisciplinary approach. I think it is important to know where a lawyer or someone with policy experience comes into play is the research portion and the legal collection, but we have trained both lawyers and non-lawyers on this process.
And there aren't enough of us. We can't move this work forward on either end, which is, I think, part of the reason why we're doing these sort of training people pre-conference sessions, because we need folks who have an interest and folks with whom this resonates and where they can see, not only, increasing the understanding of their staff, but better understanding how law is impacting what's happening in their communities in the realm of public health. We need more people at the table who understand how to do this type of work.
Absolutely. And in regards to the Public Health Law Academy trainings, what career stage of public health professionals are the trainings designed for? Are they for entry level, intermediate, or more advanced level trainings?
So they are meant to be primarily, our focus in the trainings was on mid-tier public health professionals. So according to the Public Health Foundation, that would be that 5 to 10-year mark, maybe not supervising an entire staff, but have some sort of program management or supervisory role. But our trainings are, they run the gamut. Our public health law past and present is really an introductory training. I will say that we've had people who have been in public health for years, who are decades, who are excited about the information because they finally have a place to go and just get that context. And then there are the folks that are new to public health who are just excited about understanding the role of law in the work that they're doing or plan to do in their careers. And then, for our legal epi training, I think that an understanding of basic public health legal principles is important to really get all of that you can out of the legal epi trainings. And so those may be a little more advanced, but our goal was to kind of target that middle-of-the-line professional. And our hope is that trainers, facilitators, those who want to implement the trainings, that they will identify who's in their audience and then customize the training to meet those needs. If you've got a more entry-level audience, you may want to spend more time on terminology, on principles and key concepts. If it's a more advanced audience, you may want to dive directly into more technical issues. So I really think that our products are meant to be flexible, but the target audience would be that mid-tier public health professional.
Excellent, thank you. We got a specific question about local health departments that perhaps have requested a training on a specific legal principle, like on statutes. As a state health department, where would you suggest that they start looking for a state-specific training?
That's a really good question. We are working with state bar associations, currently in the process of working with DC on a course that's going to be a CLE course that is built a lot on the Public Health Law Academy trainings. We are, of course, trying to use information, the laws and statutes that are specific for DC and the surrounding jurisdictions, but once we get that approved for CLE, it'll be approved for 46 states, and our goal is to take these materials and start to integrate them with state bar associations and build better relationships between state bar associations and state health departments so that information can be shared across the board. But even for us, when we are looking for ways to customize our roadshow trainings for jurisdictions, we've got to go into Westlaw and find the laws specific for that jurisdiction that we're looking for, and they're not always easily accessible for practitioners in the field. So we're hopeful that our work with bar associations will push more in that direction to make that information a little more easily accessible to our public health practitioners and partners in the field.
That's great. And it sounds like in the meantime, local or state health departments could reach out to you or the Public Health Law Program for
Absolutely. Absolutely. We have a team of intellectually curious, really smart staff attorneys who would be more than happy to help guide folks in the right direction if they want to build state-specific public health law training, or if they're just looking for specific statutes that are on point for issues that they're dealing with.
Excellent. Thank you. There's a question here, I think probably best suited for Lindsay, and it says, in your experience, how long does it take to see the effect of a certain law or policy on practices at a population level?
So that really depends on the domain. Using my example from the webinar, with youth TBI laws, every state had enacted a law between 2009 and 2014. And notably, there was little to no evaluation done within that time. It just trended throughout the state legislatures and people were picking it up. Now, now that it's 2018, 4 years later, after every state has a law, there has been evaluation done. And we know that some policies within those state laws are having an effect, such as return to learn or return to play, where you keep a student outside of the classroom or outside of the field for a particular amount of time. So I don't think that there's a set, number of months or years where you see an effect. I think it really depends on the law. Something like minimum wage or earned income tax credit, you may see the return right away where you're putting money in pockets. But other laws, it really does vary. That's a great question. But unfortunately, I don't have one standard answer for that.
And the question had non-medical use of marijuana as the example. Do you have any other insights into that specifically?
Yeah, not exactly. I think that that's really the whole reason that we do what we do here is to, measure that law. So we would look at non-medical use such as cannabis in food or cannabis oil in food. We would look at those laws across a certain number of jurisdictions, create the legal data so that a researcher can overlay it with outcome data and see what that law is doing. You can imagine that, and as Montrece said, many of these laws have immediate effects, but on what scale that would have to be measured.
Right, absolutely. Thank you. Thanks everyone for submitting questions. We only have a couple left, so if you have more burning questions to ask our speakers, please get them in now. This question is for Montrece. Is there a way to suggest ideas for future Academy trainings? Montrece, are you muted? Are you there, Montrece? Otherwise, we can move to
Can you hear me?
The next question. Oh, yep, now we can hear you.
Sorry about that. Can you repeat the question for me, Alexis?
Sure. Is there a way to suggest ideas for future Academy trainings?
Absolutely. Please suggest ideas for future Academy trainings. You can really simply email me at mransom@cdc.gov. There is a place on the publichealthlawacademy.org website where you can offer suggestions and feedback. We want to know what folks want to receive training on. We're in the process now of coming up with our next 5-year plan. We've gotten some serious or some strong suggestions that we do a training on administrative law. So that should be in the queue. We've gotten some requests on tribal public health law and federal Indian law. And so we're thinking about ways and subject matter experts we can work with on that. So we're definitely open. We've had folks in the field emailed me and say they're interested in training on HIPAA and data sharing, data privacy. So we're absolutely open to folks who are interested in helping us develop curriculum, as well as just topics and ideas that will help you in your work. Absolutely.
Excellent. Thank you. And then before we close, could Montrece and Lindsay, could you remind everyone again when your pre-conference sessions will be held and what time?
Yes, so our session, the Public Health Law Academy Train the Trainer workshop will be held on October 3rd from 2:30 to 4:30 p.m. Please join us.
Great, and our session is, again, hands-on training in policy surveillance, a crash course in legal mapping techniques and tools, and it will be on October 3rd from 3 p.m. to 5 p.m.
Great, thank you both. So this concludes the portion of the webinar, and I'd just really love to thank our distinguished panelists today for sharing this really useful information and such valuable resources with us. And I look forward to learning more in person. And thank you everyone who tuned in to today's discussion. And just a reminder before we close about the 2018 Public Health Law Conference that'll be held in Phoenix, October 4th through 6th. If you haven't already registered, please do so. And please register for our pre-conference sessions on October 3rd on the Network for Public Health Law webpage. Thank you, everyone.
Thank you.